Peter's here with Omaha Spine and Sport. Just wanted to talk about a quick cue that we use in the office frequently with our general population as well as our athletes. And it has to do with thinking about your pelvis like a bucket of water. And the reason we think about it as a bucket of water is a good visual for patients to kind of understand their spinal positioning and how that is impactful on their performance as well as their reducing the risk of injury. So a lot of times people come to us after they injure themselves, so then this is a good cue as they return to that activity, whether it's squatting, deadlifting, whatever. Or we talk about just, hey, I have pain when I squat, and this is what it is. And if you think about your pelvis as a bucket of water, you don't want the water to spill out the front, so you want to avoid that anterior pelvic tilt, and you don't want to spill it out the back, where that lumbar flexion that commonly happens at the bottom of a squat. And the reason is because if your pelvis is neutral or you have water in your bucket, it's able to dissipate loads throughout all the spinal structures. As soon as we start pouring water out the front, pouring water out the back, we tend to favor certain structures and we put them under too much load, especially if we have a lot of load on the bar or the kettlebell. So if you think about your pelvis like this would be anterior pelvic tilt, right? We're too much force going this way. We're spilling water out the front as opposed to the other way. Now we're too rounded and we're spilling water out the back. So with those two, we're kind of loading the facets on the first one and the disc on the second one. Very simple, but if we keep it neutral, then we have more shared forces throughout our lumbar spine, less likely to get hurt. We're probably going to perform better because we're using the muscles the way they're supposed to be used. If you look at our previous video on how the core functions as a force transmitter, basically we want to be rock solid through here. We don't want a lot of movement. We don't want a flexion extension cycle in the bottom of a squat or a deadlift. Rock solid through here by diaphragmatic breathing, intra-abdominal pressure kind of allows the big muscles of the hips to function. And that's important because ultimately with a squat or a deadlift, those are the muscles we're trying to train anyway. So a good cue, whether you're a coach, whether you're an athlete, whether you're general population, just doing those exercises is to think about your pelvis as a bucket of water. That way you're already thinking of neutral spine. And then if you watch the other video on how the core functions, if we can be able to create tension throughout the abdomen, it's just all the more staying safe. So not only are the joints in a good position, but we use intra-abdominal pressure to support them. So that's what I would encourage you to do. Think about that the next time you squat, deadlift, and focus on your starting position, because so many times we actually have people or athletes already dumping it out, water out the front, so they're already hyperextended because people know that they're not supposed to round their backs. It's called extension compression strategy. More on that later with additional videos, but for right now, think about your pelvis as a bucket of water, try it out, and get back to us. We can help you from the soft tissue restrictions or the joint mobility. If you feel like you get to a certain point and you have to go one way or the other, that'd be a great time to come see us to kind of sort that out, and we can kind of play with your feet a little bit and kind of work around maybe some anatomical or joint restrictions so we can help you squat safer, better, deadlift safer, better, and hopefully maximize performance. That's what we're here for. So if you have any questions, give us a call, 402-933-4447, or shoot me an email, omahaspineandsport@gmail.com. Thanks a lot.